breathing, paced breathing or guided breathing, relevant to the control of hypertension? Because I saw it in my eyes, and turns out it had been studied many times. Since 2006, this was reported in journals. In 2006, entitled, this is Slow Paced Breathing and Autonomic Function, which is basically sympathetic, parasympathetic that we talk about. And especially this, effects of mental relaxation and slow breathing in essential hypertension. So let's define. So if you like this, please, if you like this topic, stay put, hit the like button, both in the blue and the red medium, and follow through, because we're going to dive into the mechanism of hypertension, because not all hypertension doesn't really need to be treated with medicine. And I challenge you that, because it's happening in front of me. I'm going to have a special guest also today that would share his experience about how his blood pressure is controlled in front of him by doing just guided breathing. And one actually also is not here today, have successfully controlled his blood pressure by removing the stimulus, which in fact was the constant news cycle of some cable news. Particularly, it was something that the undesirable events, especially recently in Minneapolis, negative emotions. And then for a week that I made him, the medicine is meditation, duration is 20 repetitions, 4 times a day. His blood pressure from 150 to 160 over 100 over 100 to 110 went down significantly without additional medication, because he's taking heart medicine, went down to 110 to 120 over 80 consistently. So that is how we're going to present today. In fact, also, I'm going to incorporate how guided breathing or paced breathing is incorporated to a prayer, the breath prayer that is very therapeutic, this time for your soul, and also the meditation that we always propagate, recommend, the unconditional love meditation of His Passion. So let's begin. So what is hypertension? Essentially, a normal blood pressure is defined now as a blood pressure less than 120 systolic above, over 80, which is the diastolic. Why is this important to define? Because before, blood pressure was normal at 130, not anymore. 140 was like, oh, mild hypertension, not anymore, because that belongs to the category of stage 1 hypertension, which is associated with chronic kidney disease or end organ damage, specifically the kidney. So, come to think about this, we can take care of ourselves without medication, really. The second stage of hypertension, the abnormal or elevated blood pressure, is, of course, 121 to 129 systolic over 80, 81 to 90. Stage 1 starts at 130 to 139 systolic, and the diastolic number would be 90. Stage 3, or stage 2 hypertension is now at 140 to 150. So what is between 150 and 180? That becomes a gray zone. But most important thing is this blood pressure elevation, which can be uncontrolled, can become hypertensive crisis, meaning you can develop bleed in your brain, which we're familiar with. A friend of ours, 40-year-old, developed stroke from bleeding in the brain. And you see blood pressure of 1 over 180 over 110. So this is urgency. You need to be admitted in the ICU with drips of IV, and make sure you don't develop further a deterioration of your clinical condition. So usually what happened was a very good patient of mine would have possibly an uncontrolled hypertension through the week, and on Friday, accumulation of stimulus, the blood pressure shoots up to 180. The good thing is I was equipped that weekend. with hydralazine IV. I gave him uh, intravenous, knocked at his door, blood pressure went down nicely, and he was spared of the trip to the urgent care or emergency room. Those are things that cannot be done without an experienced physician. Thank God I have some experience in hospital medicine, which I was able to share to my patient. I hope it doesn't happen all the time. So as we know, hypertension is often called the silent killer because you don't really need, you don't really present with symptom unless it becomes acute or unless it becomes um, um, in a crisis, for example. So, hello, Joscar, you 3 times. We notice you. Please let us know where you're at right now, and please don't hesitate to leave a question. The other thing is that unfortunately, with this patient that I know, 40-year-old male presented with severe headache. Turns out he had a bleed in his brain from a blood pressure of sí, yo hablo español, pero ahora yo voy a hablar in English porque my audience is majority in English right now. But please drop a note or a comment. So, what are the mechanisms of high blood pressure? Usually, it is the sympathetic tone. Used to be, it's called essential hypertension. What is essential in hypertension or secondary hypertension? Well, let's break that diagnosis. Secondary hypertension is high blood pressure secondary to underlying condition, like, for example, kidney damage, polycystic kidney disease, acute kidney problem, and then your blood pressure goes up. Or less common would be a tumor that produces norepinephrine and norepinephrine, or those pheochromocytoma, for example. But the majority of blood pressure elevation is called hypertension. And the majority of that is usually caused by sympathetic overtone, stress in simple term. You can accumulate stress. Stress is good when you are able to recover. But if it becomes chronic, then you can increase the cortisol. The cortisol increases sugar. Sugar increases, stimulates the adrenal to produce norepinephrine and epinephrine. Now, this is where we capture the breathing because the only thing, and I can say that with confidence because I've experienced it myself, the only thing that can really mitigate the effect of sympathetic overtone is meditation, guided breathing, and mindfulness. And as we know, here in our discussion in medicine, faith, Catholic faith, we use the unconditional love meditation of Christ's passion that we meditate together with the guided breathing. Deborah Misra 7657, hello. Please drop a comment whenever you need to. So, that being said, that is the reason why we see it. I see it in practice now that if a patient by the name of my friend here is willing to share, came in today or the other day also, and came in today with a blood pressure of 160 over 110, correct? No? I tried to bring him to whatever it was, 130, made him breathe. It was not successful in the first few cycles. It just went down to 159 over 100. So I was getting concerned that it's not responding. Well, there was something that I noted. He was breathing tight, like grunting. When I said this, do this technique. Breathe and produce the word Yahweh, like this. Joskar and Dabra, can you hear the breathing? See? Good. So, with that breathing, he was able to express freely the breathing. And then we incorporated the guided breathing together with the Jesus prayer that had been practiced in 400 BC, 400 AD, after the death of Christ, in the desert, the great Anthony of the desert. He would incorporate Jesus' prayer as when you increase or when you inhale, you would say, Jesus, Son of the living God. When you decrease, when you exhale, you say, have mercy on us sinners. And that's exactly what we did. After the 10th or 15th cycle, we incorporated that. Suddenly, the blood pressure went down from 160 to 1 over 110 to 130 over 80. And he is a witness right here, Dr. Titos. Yes. The other patient with the other patient stopped watching the news, the cycle, CNN that he was watching. And uh, I made him comply 4 times a day when he woke up, noon, 3 p.m., with a Divine Mercy chaplet, and also in the evening. His blood pressure, when he presented the same 160 or 110, not hypertensive crisis, but enough to really um, not enough to be a hypertensive crisis, but then you the when you when he did this 4 times consistently at home, his blood pressure was 110 over 80 to 120 over 80. And then sure enough, when I checked his blood pressure, it was consistent. So yes, we believe in Jesus, especially the passion of Jesus, his unconditional love, and that's what we use for our guided meditation. So that proves that the mechanism of disease of hypertension, especially this essential hypertension, is primarily from sympathetic overtone. What is sympathetic overtone? It's a fight flight that goes to your amygdala. The amygdala processes it, captures it. And if you don't get out from that by really actively converting the sympathetic to parasympathetic, by doing guided breathing and meditation or guided mindfulness, you cannot really drop your blood pressure that way if you sit in the beach relaxing. You have to meditate, guided breathing. And we proved it. What is the mechanism? Because in effect, when you do the guided breathing, you actually increase your heart rate variability, which is the heart rate variability, which is the variation of your heart rate in relation to your respiration. The more variation of your heart rate to the respiration, that's what you call heart rate variability. The more the heart rate variability is increased, that is consistent with the parasympathetic tone, which is resting and digesting. You rest and digest. So, that being said, other effects would be that your microbiome also increases into a good microbiome that that ferments bacteria, the fiber that you eat for the vegetables. It produces a fermentation product like butyrate, acetate, and propionate, which heals your gut, the leaky gut that you suffer after stress. Now, this bacteria also stimulates the production of serotonin, which is the neurotransmitter that is happy neurotransmitter, to stimulate the enterochromaffin cells, the yeast cells in the lining of the small intestine, to produce serotonin, which is the happy neurotransmitter that is captured in the capsule called Prozac and Zoloft. So you don't really need those pharma serotonin. In essence, when you meditate, one effect would be also that you will be more happy. You'll be more altruistic. Studies actually have shown corporate America actually did this, making the donors in the golf tournament go fundraising to meditate for 12 minutes. Guess what happened? Those who did not meditate did not really shell out money. Those who meditated, they actually had contributed more. So lesson, let them meditate even in the corporate world. And actually, that's been happening in the corporate world. They're encouraging their clients or their employees to meditate. But unfortunately, they just do the Eastern meditation. As Catholic Corporation, we should be doing unconditional love meditation through His passion, as what's prescribed and practiced by our saints. Adrenaline increases heart rate, adrenaline and norepinephrine and epinephrine. These actually would decrease when you meditate. That's why when you meditate, it's almost like instant from 160 to 130 because it shuts down the norepinephrine and epinephrine. Take it as a medicine. The dose is 20 cycles. And most of the protocol actually would give you a 10-minute breathing daily. But in my opinion, since the stress goes through the day, it should be 4 times a day, morning, noon, and we have a beautiful devotion to the 3 o'clock prayer, and also at night to capture all these things that's happening to counteract the effect of the sympathetic tone. So you can try this. So when the adrenaline or when the norepinephrine is increased, it constricts or narrows squeezes the blood vessels. Imagine a hose. When you let the hose just drip, the pressure will not be is just normal. When you constrict the hose, the pressure goes up, and it actually able to shoot up far. The pressure increases. So what happens is if the pressure is increased in the blood vessels, especially the kidney will behave such this. The constant pressure increases inflammation in the lining of the blood vessel. It creates scars, and eventually that scar constricts the blood vessel supplying the kidney, such that the constricted part of the blood vessel will minimize the blood supply to the kidney. Less oxygen supply to the kidney, little by little, those kidney cells called nephron will die one at a time. That's why it will develop into what you call a chronic kidney disease. My friend, unfortunately, he's a urologist. His blood pressure was not controlled, stayed around 140 to 150, 160. 6 months after his retirement, he was scheduled for dialysis. So that's how devastating high blood pressure is if you don't take care of it. There's really different paradigms of high blood pressure. Number one, it's related to diet. And guess what? It is not just related to sodium intake, because that used to be the teaching. It is sugar that is the primary factor that increases the blood pressure by way of sympathetic overtone. And guess what had happened to us? The processed food, the food that's laden with high fructose corn syrup from processed food or from anything that's sitting in the counter, overdosing yourself with orange juice or any type of sweetened drink, that increases the blood pressure. It increases the uric acid, which is also associated with cardiovascular disease. So first would be decrease fast on the sugar. Avoid that. Where do you get the sugar? From the table sugar, number one, from fruit juices, from sweetened drink. All those sugar coming in from refined carbohydrates like rice, pasta, and pizza, for example, or white potatoes. The more fiber you have, the better. So fiber is obviously coming from the vegetables. 2 cups of vegetables is what I would recommend, at least. Others would say 8. Good luck, because even 2 cups of vegetables is very difficult to comply. The recommendation now, the current recommendation is the U.S. dietary guideline is to consume at least 45 grams of fiber. Where do you get that? 25 grams of fiber from 2 cups of vegetable twice a day. That's 4. That's 25 grams. The rest would be from maybe coming from chia seed or chia seed, however you pronounce it, early in the morning with yogurt or avocado, dried fruits like dates, prunes, or figs, for example, legumes, beans. Those kind of food should be part of your food every day. What is the reason why you need fiber? Your body doesn't need fiber. It's the bacteria, the microbiota that needs fiber. Because number one, if you don't eat fiber, what happens is this. That bacteria that predominates will scrape up the mucin layer of the intestine, opening up the gap within the intestine, causing intestinal permeability and increased leaky gut. Likewise, it also demolishes the microbiota or the good bacteria. That's why part of our treatment plan here in Cadenza is to replenish it with yogurt, maintenance of yogurt that's medically that we prefer meant for 36 hours based on the knowledge of Dr. William Davis. So that is the the most important thing that would be the base of treatment for hypertension. Number one, avoid sugar because it increases sympathetic tone. Feed the bacteria or replenish the bacteria because you need the bacteria to ferment the fiber. And of course, concomitantly, load up with bacteria with many different things. So the center of this all is really guided breathing and um, mindfulness. Guided breathing, simply, you do this like a Jesus prayer. You inhale 4 counts, hold 4 counts, exhale 6 counts, hold 4 counts. Let's do it. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Hold, 2, 3, 4. Inhale. Hold, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. 1, 2, 3. The dose that I have seen is 20 repetitions of cycle, and it usually lasts for 4 to 5 minutes. If you incorporate Jesus' prayer, that would be in you inhale, Jesus, Son of the living God. You exhale, have mercy on us sinners. At the top of the hour, 3 o'clock, then you can use a chaplet of divine mercy. You say, when you inhale, for the sake of his sorrowful passion, exhale, have mercy on us and the whole world. Even the rosary, meditative rosary, you can use this as your guided pace breathing. So we have the tools, lifestyle, and all these things will connect. If you increase fiber, you lose weight. As you lose weight, definitely, independently also, the blood pressure goes down. If you decrease your sugar intake independently, because your sympathetic tone is lesser, then your blood pressure goes down. If you meditate by a different mechanism, the blood pressure goes down because serotonin goes up, norepinephrine and epinephrine decreases, hippocampus increases in size, which is the brain center for happiness and joy. When you're always happy, it also feeds to the parasympathetic tone. The bacteria also improves in population, and everything becomes a happy place. Your blood pressure goes down, you will be less predisposed to stroke and heart attack. So, with these things, I'm not saying that you don't go to your doctor because you can do these things. You have yourself followed up because it might be that your blood pressure could be secondary hypertension, meaning you have to, if persistently elevated, you have to be worked up, like an ultrasound of the kidney or the adrenals, and take some markers to make sure nothing else but the sympathetic overtone is causing your blood pressure. It would be wrong for you not to go to a medical professional because there's a lot of things that need to be considered when you have high blood pressure. That alone, you need to have to investigate your end organs like the kidney, your electrolytes, because predisposition to high blood pressure is when you have low potassium. When your potassium is low, sodium goes up. Sodium goes up, you retain more water, increase volume, increase blood pressure. That's a different mechanism. Your blood sugar needs to be checked, fasting, to make sure your metabolism is improved, is within normal limits, less than 100, at least approaching 84. Your thyroid needs to be checked. Why? Because thyroid is important for your metabolism. If your blood sugar is up, your thyroid needs to be tuned in, fine-tuned, so that you cannot just use a check for TSH or T4. That's incomplete workup for thyroid. You have to have the free T4, free T3, reverse T3, because all these things are needed to evaluate. And you need to include the the level of your iodine, um, because iodine is needed for the production of thyroid hormone. You need antioxidant checking, your vitamin C, your glutathione. You need to have a check of your antioxidants, especially the free fatty acids, the omega 3, so that you can correct it with some diet. For example, extra virgin olive oil. So to recap, we have talked about number one, hypertension can be controlled without medication. We have defined hypertension, a normal blood pressure of less than 120/80, to the extreme of 180/110, which is hypertensive crisis, that you need to go to the doctor or emergency room right away for evaluation. The blood pressure in between can be managed as outpatient or ambulatory setting. We have defined the definition or the causes of the blood pressure elevation, primarily sympathetic tone, and usually caused by sugar and cortisol stress. Cortisol and stress can be managed solely, with strong opinion, by guided breathing and mindfulness, especially mindfulness of his unconditional love of Jesus through his passion. Reports of Eastern meditation are there, but I'm not going to promote that because I'm Catholic and I'm proud of that. And, and I know that it will help my soul if I meditate on the unconditional love of Jesus rather than empty meditation of something else that doesn't give me promise of something. So, vagus nerve is a supply for the autonomic nervous system. If you hear the term vagal tone, you're talking about the vagus nerve that's supplying the setting of parasympathetic tone to make your brain calm. Do away with gadgets that are sold to you to increase the vagal tone. It does not work. Meditation works, and I see it all the time. And we can have a celebration with our brother here who has successfully witnessed the effect of guided breathing meditation to control his blood pressure, or at least to minimize more blood pressure medication that needs, which is also associated with side effects like diuretics and kidney damage as well sometimes. We have quoted some relevant papers. It's not my opinion. It's there scientifically proven that breathing exercise for hypertensive patients has been reviewed many times. And in this, effects of mental relaxation and slow breathing in essential hypertension, not the secondary type. So then again, we say, God is really good. He had provided us, well, He has continued to, provided us with all these gifts that is endowed in our body that we are to take care of. The temple of the Holy Spirit, our body, we have to take care of. But we have to submit. We have to humble ourselves in prayer, in meditation, to think about His unconditional love. He's waiting for us in the Blessed Sacrament all the time. Guaranteed, it will heal you, your mind, body, and soul. Well, this is Dr. Enad again from Ave Maria. Once again, we're coming live next week, the same time. We will be here waiting for you. White Girl Magic, hi. Deborah Misra, 7657. And Britain Wims, yes, we believe in Jesus. And Joshkar, you 3 times. These are our guests from somewhere. I hope you can visit us in Ave Maria, Florida. So long for now. Adios. Hasta luego.